An X-ray does not show pain. An MRI does not show pain. A CT scan does not show pain. An ultrasound does not show pain. Any imaging does not show pain. All right, everybody. So recently I was asked a good question that I get a lot, and it's something that I very strongly believe in. The question was, what do I do if I am still in pain even though X-rays and MRIs come back clean, negative, unremarkable, basically nothing can be found on an MRI or an X-ray. Now, this is extremely important to understand, and I have a feeling I'm going to be drilling this home for the next 30 years just because of how much it has been drilled into our society for the past 20 years already that we cannot see pain on imaging. An X-ray does not show pain. An MRI does not show pain. A CT scan does not show pain. An ultrasound does not show pain. Any imaging does not show pain. We have, for the last 20 years, been instilled into us that, oh, when you're in pain, you get imaging, which shows this change, therefore that change is causing your pain. And there is merit to imaging. I use imaging because it can be very important and critical sometimes. However, it is a logical fallacy for the situation of patient has pain. We take picture shows abnormality, abnormality causes pain. That is not how it works 100% of the time. There are times, yes, when patient has pain, they get an MRI of their shoulder, it shows a torn supraspinatus, and their physical exam and their history are already suggestive of a supraspinatus tear, and so the imaging confirms what we suspected in the history and physical exam. That does actually support the idea that imaging can show us where pain is coming from. But again, that image did not say pain coming from supraspinatus, because that person could have also on imaging had a tear in subscapularis tendon. However, the history and the physical exam don't support that the pain is coming from subscapularis. So the imaging just shows tear, which is a physical finding, tear in supraspinatus, tear in subscapularis tendons. The history and physical exam shows that there's pain potentially coming from supraspinatus tendon, and so the imaging confirms, oh yes, there's a tear. So now that imaging and the history and physical exam help us to determine how we're going to approach that tear and approach that pain because they match up. In the situations where, let's say, low back pain, because this is a more common example, low back pain, X-ray shows nothing. MRI shows nothing. So now what? You're still in pain and you're not sure where to go because you're so reliant on imaging. What you need to do in those situations when your imaging does not show anything and you are still in pain, you have to start working with physicians who are able to look past the imaging, physicians who do a thorough in-depth physical exam where they are trying to diagnose you just off their physical exam alone, because they are going to do the in-depth physical exam that is required to help determine what structure is contributing to your pain. Whether that's the facet joints, and this is again low back talking, whether it's the facet joints, whether it's the disc, whether it's the nerve roots, whether it's the subcutaneous nerves like the cluneal nerves or the cutaneous branches off of the dorsal rami. Is it actually the sacroiliac joint? So there are functional tests that physicians can do that help bring out the pain in a patient. And so when patients go through a physical exam with me, a lot of my patients are sore that day or the day after because I have done a thorough job at trying to figure out why this patient is in pain, and it's using my hands and physical exams and assessments and then imaging if I need it to confirm things that I can't do with my hands or to rule bigger things in and out. For example, going back to the shoulder, if I suspect a tear with my physical exam with the patient of the supraspinatus tendon, but I'm not sure if it's a partial thickness tear, a full thickness tear, non-retracted, or a full thickness tear with retraction, I'm gonna go order an MRI. The reason I'm gonna order the MRI is because if it comes back that this patient has a full thickness retracted tear, that is an immediate surgical referral. My hands are off because that patient is going to see a surgeon to have a consult to have that surgically reattached. Whereas if it is not a retracted full thickness tear, then there's other avenues that I can discuss with that patient without having to go down the surgical referral route. But I don't want to be wasting my time, the patient's money, doing all these things when the imaging could have helped me. So bringing it back to the original question, if you are still in pain and an X-ray, MRI, CT, ultrasound, whatever imaging has shown nothing, that means that your pain is not coming from a gross structure, gross meaning large, meaning you don't have a large tear in something, or you don't have nerve root impingement in the low back. But there are other things that are not seen on those pictures that could still be contributing to your pain, whether that's the small peripheral nerves, whether that's functional metabolic changes, whether that's inflammation. There's a lot of things that could be going on that those pictures cannot see. So remember, imaging is important and can be useful, but it never, ever shows you where your pain is coming from. It only shows you a picture of the structures which could hint at what might be causing you pain, but you really need that in-depth physical assessment in order to determine where that pain is coming from. I hope you enjoyed me framing up this question for you. Please leave a comment below, like, subscribe, do all that jazz, and I'll see you later.